think, is here. Is that right? Yes. So how many of you have a Peloton? Do you still use your Peloton? You still use it? You're the only one, I guess, in the UK. You remember during COVID, digital solutions, we're using these Pelotons, other things, and we moved on to different kind of fitness and etc. So Katerina represents a company that will talk us about the future of AI and AI kind of healthcare using some solutions that kind of have now reinforced the idea of fitness and personal kind of health in a different way. Katerina. Okay. And you've got the clicker. Thank you, Sophie. No, we'll trade that for one of those garments. Is that okay? Right, left.
Okay.
Thank you.
Great. Hi, everyone. I'm truly happy to be here today. And after absolutely beautiful analog thing, so the digital one is on stage. So after I've been approved as a speaker here and I started thinking about the topic, I had a conversation with one of the clinical director at the US healthcare company. And he shared the following with me, like, I've been told to innovate with AI. What do we want the AI to do? We don't know. We literally don't know. This is what he heard. So that's why I chose very simple topic, what AI is already doing in healthcare today and how you can start using it right now. So I'm Katerina, CEO of 3DLOOK, a company that has been building AI-powered mobile body scanning solution for over 8 years. And we're having already over 100 customers who are successfully using our mobile body scanning technology. What AI is actually is. So probably many of you already know, but I will repeat some small things. So it's not a sci-fi concept. It's about using data to provide us with smarter insights and faster decisions. Think of it as a tool that learns for every patient case, every scan, and every note, just like you do, and helps enhance your clinical experience. If we show AI thousands of cases, it begins to see patterns. Small changes, subtle trends, tiny signals that are almost impossible to notice at human speed. So AI's jobs is very clear. See earlier, think faster, and support clinicians with the information needed to act with confidence. That's it. So one of the biggest problems in healthcare is waiting. Waiting for appointments, waiting for decisions, and AI is helping with that. Sorry. So here is a simple way how it works. First, rule-based system. Very simple. They are built from established guidelines. They alert clinicians when something needs attention and support consistent decision-making. Next, machine learning. This type of AI learns from patterns in structured data, lab results, medical histories, wearables, and helps predict risks and outcomes in advance. Third, deep learning and computer vision. This is AI that sees, interpreting scans, images, and signals with precision, spotting subtle changes human might not notice immediately. Together, these tools don't replace expertise. They enhance it, that make it easier to focus on the patient, not on the paperwork. Moving from data to communication. Natural language processing. This AI reads and understands text. It turns long notes into clear summaries. Conversational AI. Think of this as a helpful digital assistant. It guides patients, collects relevant information, and keeps them engaged between visits. AI-enabled robotics. These systems support precision, rehabilitation, logistic, and repetitive tasks. Together, all these tools helps healthcare become more personal, more connected, and more responsive. How all those AIs can be applied in practice. First, early spotting. AI can see health risk years before anything feels wrong, improving outcomes by from 20 to 30% and cutting delays by 40%. Second, clearer decisions. When clinical, genetic, and lifestyle data come together, AI gives a full picture and helps choose the right treatment. Third, staying ahead of problems. AI can flag when someone's health is starting to slip. No action happens early and overall costs drop by around 20%. And finally, care anywhere. With telehealth and smart tools, AI cuts wait time by half and brings care to people who couldn't assess it before. So again, faster answers, earlier support, and care that truly fits each person. Despite not being a doctor, I'll be talking about specific fields. Feel free, correct me if I'm wrong. So heart disease is still the biggest killer in the UK, affecting over 7 million people. But AI is changing how we prevent it. AI brings together signals from wearables, blood pressure monitors, ECGs, and even body scanning tools that track real changes in the body. It matches these with genetic risk to spot trouble long before anyone feels unwell. I can't avoid giving an example in preventive care because this is where AI truly shines. Up to 40% of cardiovascular risk is genetic, and early detection can reduce readmissions by 45–40% through proactive management. FitXpress is a startup, so they combine genetic profiling and AI driving risk prediction using data from UK Biobank and FinGen to identify individuals at high risk of heart disease or heart failure before symptoms appear. Another example comes from eye care. It's the busiest outpatient specialty in the NHS, yet more than 600,000 people in the UK are already living with sight loss, much of it preventable. AI is changing that. It looks at standard eye images and spots tiny changes the human eye can't see. In large NHS pilots, it improved detection by about 25%. Ultras is a great example of how AI can transform everyday clinical work. It takes standard eye images and analyzes them with incredible precision, spotting subtle changes the human eye often can see. Let's move to another major challenge, metabolic health. Over 60% of adults in the UK are overweight, and this alone costs the NHS around 10 billion a year. But AI is helping us act earlier, not just react. It brings together data from wearables, glucose, sleep, nutrition, activity, and even uses body scanning tool to track real changes in fat and muscle. And quickly about my company and what we do. So very simple. With just 2 photos, we measure whole body, we predict weight, and we're helping with the GLP-1 prescription, and we're helping to verify the self-reported data. So in 45 seconds, we're reducing time that clinicians need to check the photos and all the information with their eyeballs. So, and they reported from 25 to 30% of mismatch between self-reported data and uploaded photos. And review takes like from 4 to 6 minutes per case. But we do this like that immediately. So one of the biggest transformation is happening outside hospital walls. AI enables care anywhere through telehealth, remote monitoring, and unified digital records. Data from wearable scans and patient histories is merged into one profile, accessible securely and instantly from anywhere, and what is more important, in different languages at any point in the world. Telehealth is a single app that is transforming how healthcare is delivered by combining AI, telehealth, and patient data in real time. It integrates data from wearables, medical records, and AI-powered diagnostic into a single platform, allowing clinicians to make faster, more accurate decisions without needing in-person visits. So, how do you start with AI? Be curious, explore what AI already does in your field. Start small, choose one practical use case and test it. Collaborate with the tech partners who understand both AI and healthcare. Measure outcomes, but not hype. And stay human, because AI handles data, but you handle care. It's really like that's straightforward. Thank you.
Thank you. Thank you, Katerina. A question for me, your platform with AI tools assessing body composition for GLP-1 and weight loss, is that integrated in weight plans and other companies? They put that into your system? How does that work? Tell me.
Yeah, it should be integrated into either your platform or your application to look as a part of your patient journey, and all the data falls into your system.
Great.
So we provide just a technology
Sure.
that accurately measure the body.
And 2 photos taken on a smart camera.
2 photos front and side, one like that,
Great.
another one like that.
And that's it.
In 30-40 seconds, you're done.
Amazing. Thank you so much, Katerina. Thank you so much.
You.
Thank you so much. Okay, so one of the things I must say about the presentations,